Department, here to give you our Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. So around the world, there have been 9.1 million cases of COVID-19 disease with over 470,000 deaths. In the United States, we're just over 2.3 million cases of COVID-19 disease with nearly 121,000 deaths. In Alabama, this morning they were reporting 30,670 cases and almost 900 deaths. And in Mobile County today, our daily report is on 3,074 cases of COVID-19. That's an increase of 37 yesterday. So yesterday we added 37 COVID-19 cases. Among those, 277 are hospitalized and 133 have died. See, want to share some information with you today. The Mobile Area Better Business Bureau released a scam alert today warning people about COVID contact tracing and how it inspires copycat scams. And we were asked to provide some information to participate in the development of this alert last week, and just wanted to share some of it with you. Alabama health officials are using COVID-19 contact tracing programs to slow the spread of disease by informing people who have had contact with someone who has tested positive. Of course, scammers are finding nefarious ways to use these efforts for their personal gains. So if you receive an unsolicited message via text, email, or social media messenger to say that you've come in contact and instructing you to do things and asking you to click on links, don't fall for it. The links may contain malware that download to your device. Another version of the scam involves robocall claiming to be part of contact and tracing efforts. Again, telling you that you've been informed or been exposed to someone who has COVID-19, and then asking for information that might give the caller or the scammer information that they might be able to tap into your financial accounts or your protected information. So says while contact tracers do normally reach out by phone, be sure to hang up if the person does not identify themselves as a Mobile County Health Department employee, if they don't already have information on you. So they will have your name, your birth date, other information, and they will ask you to verify that, but don't offer that up if they don't already have it for you. So again, just be careful out there, but answer the call of public health and help us slow the spread. Contact tracing is one of the most, case identification and contact tracing is really important to slowing the spread of disease. And when the Board of Health calls you, please answer your phone and help us slow the spread by breaking that transmission cycle of COVID-19 transmission in our community. So let's see what else I have up here. Wanted to talk a little bit, we've been saying that our trends are going up, the cases are going up primarily in those younger age categories that have, mild to moderate illness or are asymptomatic, but we are still concerned about our most vulnerable members of our community. So that's why we ask you to keep wearing a mask to protect them. So I just want to give you some information. This is nationally, that the risk of serious disease and death from COVID-19 in the United States increases with age. Those with underlying health conditions are also at increased risk for serious illness and death. So if you are of any age and have an underlying health condition, you are vulnerable to serious illness and death. So among adults 80 years or older with confirmed COVID-19, 33% of them require hospitalization, around 4% require admission to an intensive care unit, and about 28% die. And slightly younger than that, so among adults 60 to 79 with confirmed COVID, about 27%, slightly less, but still a large number of them require hospitalization, around 5% need ICU, and an estimated 10% die. So again, these are very serious outcomes for our older community members. And then 8 out of 10 deaths reported in the U.S. have been in the adults aged 60 years or older. These are very similar to the trends that we see in Mobile County. So again, asking you to wear your face covering is more about protecting others from the germs that you might be carrying. Because if you're in the younger age group and you're healthy, you may be infected and you may be transmitting or infecting others without even knowing it if you're not wearing a mask in the community. So if you have COVID of any age, but certainly those that are older or have underlying conditions, you should watch for these emergency signs like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. If you have any of those emergency warning signs, you need to seek emergency medical care immediately. Call 911 or call ahead to your hospital. Notify the operator that you're seeking care, or you're someone who has or may have COVID-19, so that they can prepare to receive you and reduce transmission in the healthcare setting. So really important, if you're older or you have some of those underlying medical conditions, that you watch out for those very serious complications of COVID disease. So just some information, other information to share. Let's see. Our state health officer wanted to remind everyone that most of our new cases are due to community spread, not associated with healthcare or nursing homes or detention centers. We're still seeing a few number of cases there, but not like we were a couple of months ago. Most of our cases are now community spread. And Dr. Eichel just wanted to remind you that the portal of entry for COVID-19 is the nose and mouth area, right? So, if I'm within 6 feet of someone who has COVID and they cough or sneeze or breathe, or talk loudly or sing, then they might expel respiratory droplets that will land in my nose and mouth area, and that's how I would become infected. So wearing this face covering helps protect, I'm trying to protect you, and you wear yours to try to protect me, so that those droplets stay in the mask, not out in the air where they might land in the nose or mouth of others. Cloth face coverings are highly recommended. Our health officer previously strongly recommended in a health order, and is asking that everyone has a personal responsibility to wear their face covering in public. So this is just take your part in protecting our community very seriously, and take some personal responsibility for protecting others. Wanted to remind folks that we have not ended the first wave, so we are still slowly climbing. Right? We are still in this part of the climb, so we haven't peaked yet. So we certainly are not ending our first wave. And then the health officer also wanted to remind you that although rare, it has been, a lot of people think, well, I'm just going to go ahead and get sick and just get it over with and just get back to business. But there have been some, even in people who have recovered, some serious long-term sequelae, some health effects, some long-term health effect to your lungs or to your respiratory system. And we'll learn more about that science as we continue to learn more about this novel coronavirus. So please take it very seriously, because it's too early in this pandemic to know if there are long-term side effects to having a mild or asymptomatic infection right now. So please, just take it seriously, and know that we're still learning as we go along, and there could be, there likely are some long-term health effects, negative health effects, that we'll learn about in the coming weeks and months and years. All right. Can't talk today. Today we released a news release on being safe this summer, to follow tips, particularly, that 4th of July is just around the corner. Just want to remind you that at least until July 3rd, we really discourage buffet eating. If you're going to have a buffet, you need to have, servers who wear masks, not people serving themselves. Need to keep your foods at proper temperatures. There are other things that the health department and the state health department are reminding you to do, just that COVID-19 spreads easily. Decisions on fireworks and large community gatherings should be made with the priority of keeping community members safe. High-risk members of the community, including senior citizens and people that suffer from chronic diseases, should be increasingly and especially aware of their risk and should avoid gatherings when they cannot appropriately social distance. And again, that means 6 feet to mitigate the spread of the virus. There are some other things. Again, know what's going on locally in your community and try to particularly stay away from people that live or have maybe traveled here from other areas. We know Florida is experiencing a very rapid rise in the number of cases. There are 19 other states that are seeing much stronger and steep rises in their case counts, and you just never know if you're on the beach or watching fireworks or waiting on curbside pickup where the people standing around you may have traveled from, and their situation from the area that they came from may be very different from here. So it could increase your risk. So the longer you're around, people without your face covering, that all increases your risk of COVID transmission. So some other advice about fireworks, so safely enjoying fireworks, about grilling to make sure that we want to reduce injury related to people grilling in their backyard, either with charcoal or gas grills. Again, always make sure you keep food at the appropriate temperature. Try to avoid buffet style arrangement of foods. Make sure always that you think of sun protection. Limit exposure to direct sunlight, use sunscreen, reapply frequently, those sorts of things. Beach safety, there's some guidance on safety at the beaches, including making sure you're swimming in areas that maybe have a lifeguard, stay within designated swimming areas, obey all instructions, always swim with a buddy, stay aware of local weather conditions, watch out for rip currents, how to sort of handle it if you're caught in a rip current, pool safety, temperature, what to do in hot weather, things like moving to a cooler place if you start to see signs of heat stroke, making sure you stay hydrated, and then again using repellents to deter bugs, including mosquitoes, ticks, and some flies that can transmit communicable diseases. Okay, anything else from that I should hit on, Mark? Did you have something that you wanted me to do? I've got one other thing here and then we'll be done. So a question came in. I get this one a lot. So a question from someone in the media saying that they have a report that a hotel where some members of the staff tested positive for COVID, and the reporter's being told that the rest of the hotel staff and the guests were not notified. Shouldn't this have been reported to the health department, and how does that work? So the Mobile County Health Department is not obligated, nor are we authorized to notify a business or an establishment about a COVID positive employee or resident or visitor or customer, except in some very specific situations and out of an abundance of need to implement public health mitigation measures. So no, when we find out about an employee in a business location, we are not compelled to call that business and tell them that they have had a resident or an employee that has tested positive. We conduct an investigation to determine if that patient has been around anyone within 6 feet for 15 minutes or longer. And if needed, we will contact people to let them know of their exposure anonymously. We don't tell them who they were exposed to. If we cannot sort of tease out where the exposures may have occurred, then we may decide to reach out to the school, the church, the business, or if we think that there has been a cluster of cases at a location where an outbreak or a large number of transmission or cases are resulting from, then we might reach out to that facility. But it's not given that that we call every business, that we don't shut down businesses. That's not required. And I get this question a lot, and I understand the concern and the fear. And many of these are based on rumors. Not all of them are even based in fact. And it's happening all over town. And we are happy to consult with business owners or business managers who want to call us and just walk through a scenario. If they had a positive employee or a positive resident that they found out about, we're very, very happy to consult with you to help make sure that you're following disinfection and isolation procedures and disinfection and sanitizing, to make sure you know where those resources are and that you're adhering to those. Happy to speak with you, but we won't, just as a rule, call every business when we find out about a person who tests positive that may have been on the premise. All right, so another couple of questions. I talked about the scam alert. How is the county doing contact tracing? So I mentioned that a little bit, but just to recap, when we find out about a case, we call them. We identify ourselves as being with the health department, and we walk through the few days before they tested positive or the few days before their first symptom to find out who they were around, for how long, and how close. Doesn't matter if you're wearing a mask or not. Then once we get the names of all those people, then that goes into a spreadsheet, and our contact tracers start calling all of those people and telling them that they were exposed to someone who tested positive for COVID-19 and they need to stay at home for 14 days. That's the way it works now. It's still traditional public health investigation and contact tracing that we have been doing for decades with all kinds of diseases, and now we are, applying those practices to COVID-19 and have enlarged our team probably by tenfold to make sure we can get it done. Let's see. Someone was commented on how we saw the second highest number of cases in April, late last week. Yes, I'm very concerned about that. Again, we know that most of the community transmission, the cases that are happening now, are in younger, healthier people, and they will likely be well. They'll survive their illness most likely. So what I'm more concerned about is that it looked like the trend of testing, laboratory testing, was going down. So we don't want people to stop getting tested. We need about 2% of our population to be tested each month as we move through this outbreak, so that we can have the public health information that we need to make decisions about resources and mitigation and those sorts of things. If the numbers continue to rise, but they rise slowly like they have been, then I'll be okay. But we do see this fluctuation throughout the week that's affected by things like reporting and how quickly specimens got to the lab. So I will be concerned about a one-day spike, but I look more at the trends week over week, so that I can get some idea by reducing the noise in this day-to-day reporting that is often affected by things other than the biology of the virus. Facebook. Are these truly only new COVID positive tests, or does it include any antibody positive tests too? No, right now in the state of Alabama and most states, the PCR test for virus is the only diagnostic test for COVID-19. So all of the ones that we report as positive are PCR positive laboratory results. We do not investigate COVID positive antibody tests at this time. Are you testing more per day? I just mentioned that. No, the number of tests per day has actually been going down. So again, if you are unwell and you want to be tested for COVID, if you have heard a rumor or the truth that someone you were around was tested positive and you want to get tested for COVID, call 251-690-8889 and get an appointment to get a test at no cost to you. All right, how many cases are in the hospital? On average right now, we're seeing about 50 people a day in the hospital for COVID. Our number of new admissions to the hospital has actually gone down every week for the last couple of weeks. For example, last week we had 2 new admissions, the week before that 3, the week before that 7. So we know that the average length of hospital stay is around 9 days, but it can be as short as a few hours and as long as, you know, several weeks, depending on the complications that may be experienced that we've talked about, needing ICU, hospitalization, ventilator care, that sort of thing. So I believe that's all I have for today. So somebody from the Mobile County Health Department will be here to talk with you tomorrow at 2:30 to give you our COVID update. Maybe me, maybe our public information officer, maybe someone else, but we'll talk to you tomorrow and try to keep you informed. Thank you.